Alrighty. So welcome to the InsideOut Lifestyle show. Welcome, Janice.
Hi. Well, thanks.
You're welcome. So, Janice, you deal with essential oils.
Yes. I study a lot on essential oils, and I use them a lot in my practice. Yeah.
Exactly. And I'm interested in essential oils. I use them a little bit in my practice and with my work with the brain to stimulate the brain.
Right.
But before we get into some of the ways you use them, tell us how you got into using essential oils.
That's a good question. I am a pelvic health physiotherapist,
Right.
and back in 2014, I was asked to do a talk for the midwives in Owen Sound. So I went there, and my intent was to speak on pelvic health and postpartum health. And while I was there, I didn't realize there was going to be another speaker, but it was a holistic chiropractor speaking on essential oils. So I stayed and listened to her talk, and she was talking about how you could use essential oils to help with pregnancy, postpartum, and even pediatric ailments and conditions to help support those things.
Right.
So, and that's sort of what sparked my interest. I started studying them after that, and now I use them a lot as well in my practice and personally.
Awesome. And they're really exciting because they do fit the paradigm of this show, and in the name Inside Out is all about empowering your body's ability to heal from the inside out.
Absolutely.
With natural products, drug-free, all natural. So the oils I know do that, and pretty well, you can tell me better, but they stimulate parts of your brain to have a response lower in the body.
Yes.
Right?
Yeah.
So can you tell us a little bit kind of, how they work?
How they work? Well, they work in a whole bunch of different ways, but the main way people are introduced to essential oils is through inhalation. A lot of people use them by inhalation, topically, or some people will ingest them.
Right.
With respect to the brain, when we inhale them, our brain is directly linked to our sense of smell because the olfactory nerve, which is actually in our nose,
Right.
has a direct link to the limbic system or our primitive brain.
Right.
So when we inhale something like lavender or like citrus oils, they can have a calming effect on the nervous system.
Right.
Sometimes things like peppermint actually have a stimulating effect, which is what you might want in the morning, or if someone's sort of depressed, that sort of thing.
Exactly.
Yeah.
We use them with the brain really to stimulate and to calm, I guess, in some cases too. I know I use peppermint with stroke patients.
Right, yeah.
So, for instance, if their right side is affected, we'll get the patient to put peppermint oil on their hand and on their foot so that their brain is continually sensing that side that has a lack of sense.
Yes. It's very cooling. Peppermint's very cooling, so
Right.
it kind of wakes up their brain to that side of their body. Absolutely, yeah.
Yeah.
And then the smell also would stimulate, yeah.
Exactly. So the idea is to get new neural pathways created,
Right.
So that we get some function back.
Absolutely.
And along with other things we do, it works quite well. But those are things they can do at home.
Yeah.
I know when my kids were young, we used to use essential oils for them for many different things. Is there some things that pop into your head for kids with earaches or toothaches or something that you would have a go-to to?
Yes, absolutely. Well, the safest ones for little babies are lavender and Roman chamomile.
Right.
And if you're using them on babies, you can diffuse them in their room or you could use them topically. I think the biggest thing when it comes to essential oils is a bit of oil safety because over time you can develop a skin sensitivity if you just use them straight up.
Right.
So I like
They're pretty strong.
They're
some of them.
strong, especially peppermint.
Right.
So I like to use coconut oil on my as my dilution.
Right.
And I'll put a drop or two on my hand, add about a teaspoon of coconut oil, and then you could rub that on the baby's feet. If the baby was colicky, lavender is good. Lavender, a drop of lavender on their bedding. For teething, lavender and clove diluted, rubbed along the jawline. And babies need a higher dilution than like an adult would. So yeah, just one drop is often enough.
What about ingestion of it? I know there's some of them that you can ingest. I know occasionally if I feel a cold coming on, my go-to is frankincense.
Yeah.
and I'll just have a few drops under my tongue.
Yeah. So there's controversy around ingestion, but ingestion's been around, like that's what the French medical model uses is a lot of essential oils.
Mm-hmm.
I think the biggest thing with essential oils is make sure you know your company, because a lot of essential oils will say not for ingestion, and that's often because they're not pure.
Right.
So they might have contaminants, heavy metal, that sort of thing in them.
Mm-hmm.
So read the bottle. Ingestion is a great way to support the immune system. It's a good way for a urinary tract system. And if it's coated, like in an enteric capsule that
Right.
will bypass the stomach, it can be helpful for conditions of the bowel like IBS or Crohn's or colitis.
In which one? Which oil helps with the digestive problems?
I would enteric coated peppermint.
Okay.
So you can get enteric coated peppermint at a lot of health food stores where it's already pre-capsules, and then it helps with spasm of the gut and also gut pain.
All
It's
right.
an analgesic and an antispasmodic. So yeah.
Very good.
Yeah.
What about things like anxiety? Because we're seeing so much anxiety in children today.
Yeah.
Adults as well, but children, and I think it's because of this crazy high-paced pressure cooker world we live in.
Absolutely.
And the overstimulation that we're all getting, and it is an overstimulation thing, and one of the first symptoms of that is becoming anxious.
Right. So for anxiety, I recommend like inhaling them is one of the best ways to get to that limbic system in the brain.
Right.
So just that smell, it's quick. There's no processing involved, and it has a direct effect on blood pressure, heart rate, stress hormones like cortisol. So inhaling things like lavender.
Right.
Citrus oils are really good for anxiety, things like wild orange or lemon or bergamot, anything like that. And then a lot of families will use them topically on their kids as well. So I really recommend something like a roller bottle. Now this one is On Guard, but something like this, diluted mostly with coconut oil and like 10 or 15 drops of something like lavender.
Right.
And then they can easily roll it on their child's feet or the back of their neck. And then the child can do that too when they're anxious.
What about before they go to school? Can they rub it on their collar or something
Yeah,
like that?
absolutely.
I've heard them
Yeah,
do
we
that
can
kind
rub
of
it.
thing.
Yeah, absolutely.
Right.
And and in times of like a flu outbreak or
Yeah.
that sort of thing, in my studies in the UK, they actually put aroma patches on patients. So in the hospital. So if someone's immunocompromised, they're sick in ICU, they'll put an aroma patch with tea tree or some other oil like On Guard, and that
Right.
helps reduce the risk of hospital-acquired infections like C. diff and MRSA.
Yeah, which
so
are huge today.
Absolutely. So
Yeah.
even in your school environment or your work environment, if you just put a patch, or I have a scarf that I'll wear oils on,
Right.
and it will purify the air around my face.
Or there is these bracelets.
Or the bracelets or necklaces.
Or
Yeah.
necklaces. Yeah. So now there's jewelry to deliver the oils.
Absolutely. And
Yeah.
it looks cool too,
And
and
they're cool.
fashionable.
Yeah,
Yeah.
mine has a skull on.
Yes,
that one.
I like
And
that.
it's not because I'm a biker. So speaking of On Guard,
Yes.
so that's a combination. So there's a combination of different oils within that.
Yes.
I know there's a story that goes something about the plague,
Oh, yes.
and there was a number of different combinations of oils that some thieves
Yeah.
used, right?
Yes.
Can you talk about that a little bit?
Well, On Guard has a mixture of orange, wild orange, rosemary, clove, eucalyptus, and cinnamon.
Right.
So clove is what the thieves used to like put around them, clove oil, and they would rob the tombs of the people who'd passed away in the plague, and they
Right.
would not get sick. So clove oil is very, very good at killing, affecting bacteria and then also viruses. So
Right.
it's very protective of that.
So there is now, later on, science has caught up to that.
Yes.
And there is some good clinical studies proving that.
Absolutely.
Yeah.
So this potent blend has a lot of oils that can help be effective against viruses and bacteria and fungus too.
Right.
So it's a really good one. It's really hard. I've had many teachers and offices quietly diffusing On Guard, and the rates of sickness in students, the rates of sickness in like just the office workers has gone down a lot.
Immensely.
Yeah, immensely.
Yeah.
Mhm.
That's very cool.
Yeah.
So I know you have some kind of, a few of them that they're your kind of go-tos.
Yes,
What would
absolutely.
what would they be? What would your go-to be?
Well, in times of sickness on guard, I keep this in my office and I wear it around me almost like a vampire does garlic. And I have not been sick in like 2+ years. So that's a great one.
Yeah.
Peppermint's also a really good one. I enjoy that in the morning when I'm like tired and kind of lagging. I will put peppermint in the diffuser with wild orange, and that just is kind of like a pick-me-up, a coffee in the morning without drinking it.
Without drinking the coffee,
Yeah.
yeah.
Balance is another oil. It's a specific doTERRA blend. I use a lot of doTERRA oils because of the quality.
Right.
And if you're feeling nervous or anxious, Balance is really just good at sort of calming down the nervous system.
Yeah.
Digest, and I don't have a lot of digestive problems on my own, but a lot of my patients do. So irritable bowel, just bloating, that sort of thing. I've got a lot of people that benefit from the specific blend Digest Zen or Zengest in Canada. But an alternative to that is peppermint as well. Peppermint's good for a lot of things.
Yeah. I mean, I remember drinking peppermint tea.
Yes.
If I had an upset stomach when I was small. And still do today.
Absolutely,
so
yeah.
Peppermint is definitely a calming, and you're just getting it in an oil form.
Absolutely.
Other than the tea, right?
Yeah, and peppermint's also really good for like coughs, colds, for opening up airways, that sort of thing. Like if you're having trouble breathing, it's good for respiration too. So yeah.
What about? I've heard that you can use the oils to cook with.
Yes, you can, but you don't need a lot. So the thing is, I had a friend who actually used oregano oil, and doTERRA's oregano oil is not diluted, and I think she put like 10 drops of oregano oil in her spaghetti sauce.
Yeah.
It was pretty strong. You only need 1 drop. So 1 or 2 drops of anything. So you can make peppermint brownies with peppermint. You can use marjoram for a cooking spice. You can use so many different oils. You can use lemon if you're making lemon flavored cakes, that sort of thing. Yeah, just a drop.
Yeah, another go-to for me if I feel a cold coming on is I do the oregano oil as well. And the stuff I have is definitely not diluted and it's strong. And a couple of drops under your tongue is on your fire. Is on fire, yeah.
Yeah, I tend to, if I'm going to do it straight up, I'll mix it with honey or something like a bit emulsifying so my mouth isn't
I should definitely
paying the price.
Try that. Okay, so that's some great information. Other things, ADD and ADHD. I wanted to talk a little bit about that.
So
I know we probably talked about some of them that are good for that.
Yeah, often I find the ones that work for that are the blends, but like things like rosemary increase memory and concentration. So rosemary, bergamot, marjoram is also really calming. And there's a doTERRA blend called In Tune.
Right.
I don't have it with me. It's with my other thing, but it's in another bottle like this, and it says In Tune on it. And a lot of, it's got lime in it as well. And if you roll it along the back of your child's neck, people find it really helps study and focus, or alternatively along the soles of their feet. So the main topical areas that you want to put it are on the back or the soles of the feet. Yeah.
And why is that?
Because those are the most porous areas of the skin.
Right.
And then there's a lot of nerve endings, specifically along the spine, where they can sort of get access to.
And when you ingest it under the tongue, is that for the same reasons?
Yeah, for the same reasons, yeah. So,
all right.
Yeah.
Now, there's another product that they have. Is it Deep Blue?
Deep Blue? The rub?
The rub.
Yes.
So talk a little bit about that. I know it's really good for arthritis and inflammation, basically, sore muscles.
So there's 2 Deep Blues. This is, again, a doTERRA sort of proprietary blend, and it's got peppermint, wintergreen, helichrysum, cypress, and a whole bunch of oils that help with circulation and inflammation. And it comes in the oil, and then it also comes in a lotion. So the oil needs to be diluted. The lotion you can just apply like any lotion. And it's like a chemical-free biofreeze or whatever.
Right.
It's like a hot, cold feeling, but it's very soothing to acute injuries, but also like chronic issues such as arthritis. And a lot of sports teams use it, like they have it in the Blue Jays room, and just to pump up, put on like acute or old injuries.
Yeah, because we used to use biofreeze, and we would sell it, but as the oils kind of came on the scene, and our thinking was more, okay, what are we putting on, or what are we ingesting, what are we inhaling, what are we putting on our skin? And looking at the ingredients in BioFreeze,
Yeah.
there's some nasty stuff in there.
Exactly.
Right?
Yeah. Yeah.
So although people seem to like it, a definite better alternative is a deep blue.
Absolutely. And that's one of the number one selling products doTERRA has. I can't
Yeah.
tell you how popular that is. I have had people with knee arthritis, with rheumatoid arthritis come, and they find that they don't have to take as much pain medication if they're applying the deep blue.
Which is awesome, right? With the opioid crisis that we're dealing with.
Absolutely. Yeah.
Right.
Yeah.
So any alternatives to that is a godsend. For
Yeah.
sure.
And even when I was doing a lot of research, I've done quite a few talks on the science and evidence behind essential oils.
Yeah.
There is something going around Facebook now, but in the research, if you could affect we all know pain is an output of the brain.
Exactly.
And so post-surgery, a lot of people are in pain.
Mm-hmm.
And that's how opioids often start. They give them post-surgery, and then that person, for one reason or another, gets stuck on them, addicted. Yep. So they're finding out if they affect the brain through inhalation, like inhalation of positive scents, like lavender or orange. Most people do really well with citrus scents. It's the sort of universal sort of accepted scents because everyone's scent preference is different. Citrus oils are universally accepted by most people. What they find is less pain medication, and the level of pain goes down significantly just by inhaling oils post-surgery.
That's awesome.
Yeah.
And it's easy. Right?
It's easy. And you know what they'll do is put them on a bracelet like yours and then just have the patient inhale it.
Yeah.
Super easy.
Super easy. Now, that said, what is the medical community? How are they responding or how receptive are they to oils?
Well, that's a good question. Around here, it's harder to gauge.
Mm-hmm.
I think some doctors are recognizing that. I think a lot of people don't know enough about oils and think they're just things that smell nice or voodoo. Like if they don't understand, and like I did as well, right? Yeah. You have to look at the research and understand that. In the U.S., they're using them in the Mayo Clinic. They're using them in Johns Hopkins hospitals. They're actually taking part in a lot of research. Yeah. In the U.K., they've been using them for a long time. They use them they have protocols for maternity wards, for birthing. They're finding lavender on drug-addicted infants. If they inhale lavender, less stress response, less cortisol. So, yeah.
That's awesome.
Yeah.
Yeah, and you're so right because, everything evolves around the brain. The brain
Absolutely.
is our master controller. We call it Houston control.
Yeah.
And your body heals from, we call it above down and inside out.
Yeah.
And anything that affects your brain will go downstream
Absolutely.
in effect. And you can have negative effects and positive effects. And obviously we were looking for the positive effects. And when you said about the idea about smells,
Mm-hmm.
before oils kind of came on, all of a sudden we had this deal where, there'd be scent-free buildings, scent-free offices.
Right. Yeah, yes.
Because of colognes. And
absolutely, yes.
Right? So we know that smells are powerful.
Absolutely.
And they can affect you negatively or positively.
Yeah.
The good thing about the oils is we've got tons of research behind it. And speaking of that, is there any negative effects of oils?
That's a good question. And yes, there is. Mostly what you're talking about with scents is chemical sensitivity. So man-made synthetic smells. Even now that our home is detoxified and the only thing I smell is essential oils, I cannot stand walking down the cleaner aisle in the grocery store or Walmart or whatnot. Right. That's where most of the chemical sensitivities come in. Gain, laundry detergent, Tide, the strong smells are artificial. And if you watch the movie, The Human Experiment, have you seen that?
No, I haven't.
It's narrated by Sean Penn, and it goes all through all the chemicals that we use in products and how they've never been tested on humans. Right. So and a lot of them are like carcinogenic or cancer causing. Right. So that's a real eye opener. It'll make you want to detoxify your home. Febreze, bounce sheets. Yeah. That being said, most people are chemically sensitive, but the odd person is sensitive to essential oils. I know a couple of them. Yeah. So when that happens in my office, I will turn off my diffuser. My room is very small and I use oils on my patients and it often smells a little bit like essential oils, but I haven't had no complaints about that, even with my chemically sensitive patients.
Yeah. So, and I think that's a good point. Anything that's synthetic or man-made, there's a way greater chance for a side effect.
Absolutely.
And that's a whole different talk, but if we, an example of that is medications.
Yeah.
They're synthetic, they do have side effects. and they have a lot of side effects.
Yeah.
So anything natural, most of the time, has less likely chance of a negative side effect.
Absolutely.
Right?
And the only other thing, like, so inhalation, but then the other thing is topically.
Yeah.
Sometimes people just will use them straight up oils on your skin. And over time, you can develop sensitivities if you just put them straight up. So always dilute.
So you dilute in a carrier. You talked about coconut oil.
Yes.
What are some of the other carriers that you might use?
Coconut oil I like because you can use hard coconut oil, or in a roller bottle, it would be liquid. You could use, if you had olive oil, you could use olive oil. You could use almond oil, grapeseed oil.
Any of the nut oils.
Any oil, really. Avocado oil. Certain oils are really good for dry skin. Certain oils are different for oily skin. I use coconut oil on my patients because it doesn't stain their clothes and it doesn't have a smell. Something like olive oil, if you put it on your skin, you would smell it, and then it would stain your clothes if you had a shirt or something near it, right? So, yeah. You could even use lotion in a pinch, body lotion. So, yeah.
Right.
Yeah.
That's great information.
Yeah.
And I think the community will benefit greatly from that. And I know in the past, well, how long have you been involved with oils?
For 3 years now? Just over 3 years, yeah.
So I'm maybe it's 5 years. The wealth of knowledge and the more and more people that are actually utilizing oils has just been unbelievable, really, the growth of it.
Absolutely, yeah.
So, things like this that give information. I know you're out doing lots of talks all the time, lots of workshops, and, like the old adage says, knowledge is power.
Exactly.
And we need to, as individuals, we need to take responsibility for our health.
Absolutely, yeah.
Right? Because nobody else is going to do that, and do that in a way that is going to optimize our health potential.
Yeah,
right?
Absolutely.
So,
yeah. And when you're talking about the brain, just briefly too, you're talking about how we change from the brain down. One of the most important things is sleep, right? So sleep is everything. And if my patients are in pain, like the first thing I'll ask is, are they sleeping? That sort of thing.
Yeah.
And they've done lots of studies, and it drives me crazy because doctors often will prescribe sleeping pills or benzodiazepines, which wreck your sleep cycle, so you don't get your proper REMs, so you don't get your proper rest. And study after study has shown that lavender, either applied topically or inhaled, improves sleep quality. And in people with benzodiazepines or sleeping pills, they've reduced the amount or come off them completely with regular use of lavender.
Yeah, which is awesome. And that's why this little diffuser here, I have one, and my go-to is lavender at night. And I sleep like a log.
Yeah.
And sleep, like you said, is hugely important. It's where all our healing takes place. And we have to get in deep REM sleep. That's where dreams happen.
Yeah.
So if you're dreaming a lot, that's a good thing.
Yeah, it is.
Right?
Yeah, absolutely. Yeah.
So they're just so powerful.
Absolutely. Yeah. I was just talking to a shift worker before I got here who, he uses lavender, and I said, try applying it to your feet. Use it regularly and use it on the days that you're sleeping too. And and his sleep is so much better now. So he's falling asleep better and less nervous tension, less muscle pain, less all that kind of stuff. So
that's awesome, because we know that guys or gals on shift work, definitely the research is saying they have health problems because of it.
Yeah.
Right. So sleep is essential, and if you can do it with a non-toxic, natural product, that's the way to go.
Exactly. Yeah.
Yeah. So before we leave, is there any other little biohacks that you can, little gems that you can tell us?
You know what? I would just say lavender at night. If you use lavender, I have my daughter loves wild orange at night, and wild orange is good for sleep. It's good for fear and anxiety. So use your oils to sleep, because sleep, I think, is number one. And then also for immune support, I can't emphasize enough taking an On Guard, making your own roller bottle or buying your own and wearing it around your neck or roll it under your nose. Protect your mucous membranes. No one wants the flu this time of year.
Absolutely.
And then waking up in the morning, peppermint and wild orange just helps to just wake up.
Stimulate you.
Yeah. And then make sure you're supporting your body throughout the day with whatever you need. Some people need balance. Some people need a bit more boost. So like something, if you're studying for a test, rosemary has been shown to improve memory retention and learning. So rosemary for people who have exams. I guess exams are over now, but
They are, but they'll be in the
They'll
spring
be back in
again.
this,
Exactly. Well, I want to thank you for your knowledge. That's awesome.
You're welcome,
And the community is going to definitely benefit from the knowledge that we put out there.
That's great. Thanks
So
for having me. It's been fun.
You're very welcome.